My name's Mary. I'm a second year internal medicine and pediatrics resident at Mount Sinai, and I do all my outpatient work at Settlement Health in East Harlem on East 106, where I see adults and kids. So we can talk about COVID-19 and flu vaccines. I hope that today you'll leave empowered to talk with your doctors and other folks in your life about how to get vaccine protection against these two respiratory diseases that can be really severe. Just an overview for today, I'll go through this season's vaccines. As we know, our vaccines are updated every winter season and their efficacy, why we need new COVID boosters and yearly flu shots. Very brief overview of the vaccine approval process, because I know there's been a lot of talk about that in the media over the last few years. And then some myth busting about the COVID and flu vaccines and their relation to getting sick. Brief reminder about what flu and COVID disease can look like. So they're both viruses, they're not bacteria. So antibiotics do not work, but you'll get a range of, some people just get like a cough, chills, fevers, kind of end up lying up in bed for, up 5 to 7 days, up to a week or two. But the viruses do affect the lung tissue. They affect your lungs directly. So I know in the COVID pandemic, we heard a lot about people ending up in the ICU, needing life support for breathing with a ventilator, but we don't always associate that with flu. This is a reminder that the flu also causes people to end up in the ICU and can cause really severe pneumonia and even death. Every year, there's hundreds of thousands of people hospitalized with the flu and COVID. You can get complications from the flu and COVID, like bacterial pneumonia, worsening of any chronic conditions like heart failure, asthma, diabetes, and others. And then not to mention long COVID also. All of that to set the scene of why I feel so strongly about getting myself and others vaccinated and protected against severe disease. This is the longitudinal SMART reminder about long COVID, and a reminder that this is one of the really negative effects of getting a COVID infection. You're at a lot higher risk for getting long COVID symptoms if you do not receive a COVID vaccine. So I like to think about vaccinations in general as just a cheat code. My goal with getting patients vaccinated is to prevent death and hospitalization from what are two preventable infectious diseases. The risk of severe disease with COVID and flu is really underestimated. Thankfully, a lot of people out in the community are already vaccinated, so we don't always hear about some of the really severe cases of COVID and flu that end up in the hospital or unfortunately even with death. But they are out there. Every year I take care of patients. I work at Settlement and then also inpatient at Mount Sinai, and every year I take care of patients who have really severe complications from flu and COVID. I know there's a lot of talk about like doctors maybe having an agenda about getting people vaccinated. I do have an agenda, and it's really, I would love to care for like 0 patients with flu or COVID in the hospital. So that all said, I'll address this later, but that doesn't mean that you won't get sick with influenza. You'll probably still get a cold, but I really want you to not end up in the hospital. So how do COVID vaccines work? I like to think of it as your body just being taught to recognize something. So the reason vaccines are so cool to me is that you can get protection from a really severe disease without having to actually get that disease yourself. So the flu vaccine specifically is a little more of the traditional model. It'll take a part of the virus and teach your body how to recognize it. So I think about it as you see bugs out there, like I think about bees, like I hate bee stings. And if I could be protected against like a bee sting, that would be great. So when I know that whenever I see like red and yellow stripes, I know to like take precautions and like put up my defenses against a bee sting. And that's kind of what we're teaching your body to do when you get a flu or COVID vaccine, is to recognize a part of that virus so that your body will put up its defenses against the actual virus when it comes by. But then why do we need to get these vaccines every year? Like a lot of us got shots when we were little and then never needed a shot for polio ever again. Unfortunately, there's a lot of different subtypes of each virus. I think about it like ice cream. Ice cream comes in all different flavors, right? So it's really hard for stores to predict which flavors might be the favorite, but they can tell from past summers like which ones people order the most. So those are the flavors that they'll have in stock. Similarly with the flu virus and COVID strains as well. There's a lot of different types of COVID and they're all slightly different. And we don't always know which ones will be kind of the dominant strains, and same with flu. So we use our best predictions from the season prior to make the vaccine new every season. Additionally, your immunity will just wane. It'll decrease over time with COVID and flu, unlike the other shots you got when you were little. And every year there's a new round of vaccines for COVID and flu produced. And the ones for this year are really special. For the flu shot, there's usually protection against 2 strains. This year there's protection against 3 different strains of virus, which is exciting. And then for the COVID vaccine, there's updated formula that will target one of the most popular circulating variants. Then there's the 3 different options of Moderna and Pfizer, which work similarly, and then Novavax that works a little bit differently. All of them were able to reduce the risk of going to the doctor, not even like hospitalization or death, but like going to the doctor by 40 to 60%, which is amazing. And then the timing is like around now. We want to get vaccinated by the end of October, ideally. This is a little bit more in depth about the COVID-19 vaccine boosters this year. So I know we all got those 2 initial boosters way back in 2021, but now it's kind of like the flu shot going forward. We need to get a shot every year for the same reasons that I talked about with the flu. And I know you've heard a lot of different companies making different vaccines. So a brief overview of the Pfizer and Moderna, I want you to think of them as the same one. Novavax, you can think of as a different one, but they will ultimately help you in the same way. So for the Pfizer and Moderna, this is the mRNA vaccine that gives your cells instructions on how to protect from disease. And then Novavax is like showing you a little bit of the virus so that you can make antibodies against that without having to get actually infected. So anyone 6 months or older can get the Pfizer and Moderna, and then it's just 12 and older for the Novavax. They're both a single shot. And then about 2 months after your most recent COVID vaccine, which is probably most of us, is when you can get it. There's similar side effects for both within a few days of the vaccine, getting those like chills, fever that you might have gotten in the past. And that's showing us that your immune system is working actually. And these types can be mixed too. So you don't always have to stick with the same company. Who should be getting a yearly vaccine? And the answer is pretty much everyone. So anyone 6 months or older. So for our babies, we start off with 2 flu vaccines and then 1 every year for life. This is especially important for people who are at higher risk of that really severe disease, of getting complications of COVID and flu that could land them in the hospital. So that's people with immunocompromise, if you've had a transplanted organ or you have an immune deficiency syndrome, but also way more common things if you have diabetes, if you have asthma, if you have COPD. Also, unfortunate news is that just your age is actually a indicate as increased risk for severe disease. So you may look and feel great, but over age 50, the hospitalization and mortality rate for the flu increases quite dramatically. And then it increases quite dramatically again after age 65, actually. So even if you've done all your best and have been blessed and avoided any chronic illness, let's keep it that way and get a COVID and flu vaccine. If you have an egg allergy, you can receive the flu vaccine in any form. That is because the flu vaccine, it uses chicken eggs in order to create the vaccine itself. For COVID, if you've already had a COVID vaccine, you still should get a yearly vaccine. If you've had COVID-19, you should still get a yearly vaccine, though you can talk with your doctor about the timing if it was an infection in the last 2 or 3 months. And then if you've had long COVID, you should certainly get a COVID vaccine. Very brief overview of the vaccine approval process, just to demystify a little bit how these vaccines get to our doctor's offices in the first place. 3 general steps are first, lab development that happens over years. So I know we saw a lot of speed up by the COVID-19 vaccine, but thankfully there had already been research into the coronavirus vaccine for like many years prior to the pandemic hitting. Clinical trials, I'm sure you've heard those words in the news. You'll hear about phase 1, 2, 3. So those happen in 3 phases that are often over years. However, as we saw with the COVID-19 vaccine, when cutting down on paperwork, those can take months even. And thankfully, the COVID-19 vaccine was still able to enroll like tens of thousands of people in these trials. There were no corners cut other than the paperwork and red tape corners in the clinical trials there. Third is the approval phase. So that's when the Federal Drug Administration or the FDA will sit down with committees and review these clinical trials and all of the studies done and decide if they think they're up to snuff, if they've passed safety, if they've passed efficacy. They'll look at all the details of how the vaccines are manufactured to make sure that's safe. We want to make sure that's not only safe, but effective. I'm not going to come out and ask people to get something if it doesn't really do anything. And then also looking at the sites where the vaccines are manufactured as well. Wrapping up with a little myth busting session. I hear this all the time from patients and I totally understand it. I got the flu vaccine or I got the COVID vaccine and I still got sick. The first thing I say is, I'm so sorry that you got sick. Just getting sick in general stinks. And I wish that I could prevent all of my patients from getting a COVID or flu-like illness. So I say, I'm so sorry you got sick. And I'm also really glad that you didn't end up in the hospital. The COVID and flu vaccines can't give you flu or COVID. If we're using the bee metaphor, once a bee's already dead, it can't sting you. And really what the vaccine is like using that like dead bee to kind of show your immune system how to protect itself. Certainly there are so many different kinds of cold viruses out there. It's impossible to protect against all of them. And so we're already giving flu vaccines during the winter season that when cold viruses are circulating. If you're feeling sick after the COVID or flu vaccine for like a week, you probably already had a cold at the time, which is unfortunate. And then the bit about side effects, I get asked about side effects a lot, which is a great question because we all want to know, how am I going to feel after this? And I try to reframe them as actually intended effects. So if you are feeling like you have a low grade temperature, a little chills after getting the flu or COVID vaccine, that's actually an intended effect that tells me that your immune system is reacting to the vaccine. It's learning how to protect against the virus. So next time you're exposed to that virus, you'll know how to protect yourself and won't be as susceptible to that really severe illness and like damage to the lungs that can be caused. Typically, intended effects will last less than 3 days, whereas if you already had a cold when you got the flu vaccine, it might be sick for like 5 to 7 days or so. But again, none of these vaccines are live vaccines, so there's really no way to get that actual strain of flu from the flu virus. This is just another like longitudinal slide reminder to stay up to date on all vaccines. We just talked really extensively about the COVID and flu shots, which are available, RSV, which is another virus that can cause really severe respiratory disease. It's unfair that there's all these viruses out here that are trying to harm us. And then pneumonia, which is a bacteria. There is a vaccination against pneumonia also, against one of the specific bacteria that can cause really severe pneumonia. The RSV and pneumonia vaccines are for older adults or if you have certain chronic conditions too, like diabetes, so compromised things like that. Where to get these vaccines? Retail pharmacy like Walgreens, CVS, Duane Reade. Make an appointment online, walk in and ask for a vaccine, and it's taken like total 20 minutes maybe, and you can get both at the same time. You can call your regular doctor's office. A lot of clinics will actually allow you to do a nursing visit for the vaccines where you don't actually need to see the doctor, because I know unfortunately a lot of our wait times are like months and months, but you should be able to call and get a nursing visit within a week or so at most places. New York City Health and Hospitals has a testing vaccines and treatment line that you can call or go online to find sites. And then there's like some virtual express cares or like other spots that you can get vaccines at. My takeaway is I would love to have fewer people that I'm taking care of in the hospital with these diseases. And I think that vaccines are a really great cheat code to getting there.